We often hear terms like cultural awareness, cultural competency, and cultural sensitivity. These concepts are becoming increasingly important for us to understand. Why? Because as our society becomes more and more diverse, it is crucial that we treat every person who enters our facility as an individual and focus on providing that person with the best possible care. Regardless of the position you hold, whether you're a dietitian, nurse, phlebotomist, environmental services, or other position, you have opportunities every day to interact with patients and their families. You can help provide a quality care experience if you learn to apply the concepts of cultural sensitivity.
Cultural sensitivity is important because when you think about what it is that we do, we serve others. And when we serve others, we need to understand who they are and what perspective that they're coming from in order to be able to best meet their needs. And so having some understanding of their culture and having a heartfelt sensitivity to what their needs are really just helps us do what we do and do it better.
Every patient who enters this facility has a unique background and life story. Their age, gender, community, ethnicity, race, religion, functional abilities, sexual orientation, and income affect how they view the world. But other factors, like prior healthcare encounters or recent family events such as divorce or the loss of a loved one, also enter into the equation and can affect what the patient considers appropriate care. Because every patient's story is complex and individual, we are not expected to understand the differences of every culture. What we can do is understand that differences exist and that every person's background shapes their individual perspective. That's what cultural sensitivity is all about. Cultural sensitivity should begin with your very first interaction. Your goal should be to understand the patient and family and their personal wants and needs. To do this, you must first open your mind to the possibility that people will be different from you in various ways, and that you must not be judgmental of these differences. It is your responsibility to adjust your behavior rather than expecting the patient or family to adjust theirs. The next step to cultural sensitivity is learning to be an effective communicator. For example, everyone who interacts with the patient or family has an opportunity to observe cultural aspects about the patient that may impact their care. If you learn something about the patient or family that you think can be useful in providing the medical, spiritual, social, or other type of care the patient needs, it is your responsibility to appropriately share this information. You can do this verbally or in the form of written documentation, depending on your position. In healthcare, it is essential that the patient and family fully understand information and be able to communicate with their caregivers. Therefore, you may need to ask the patient or family their language preference, if they have a secondary language, and in which language they read. It may be convenient or tempting to have a family member or friend serve as interpreter, but this person may be unable to accurately interpret vital health information, or they may feel awkward sharing certain information, especially anything that is sexually related. For this reason, language line or a qualified and appropriate interpreter should be used. It may also be helpful to include cultural questions in a patient assessment. For example, where the patient was born, how long they have lived in this country, and if they consider themselves of a certain ethnicity. This information can give you valuable insight into the social needs of the patient and family. You should also be sensitive to the patient's nonverbal communication style or body language. People speak not only with words but also with gestures, facial expressions, the use of personal space or touch, and eye contact. When we tune in to this type of communication, observing what is implied rather than said, we have more insight into the individual.
There are times when we come in contact with patients that are female and do not want males as their caregivers just based on their culture. And so we have to be thoughtful about that, and we have to make assignments based on having an all-female staff, and that involves lots of different people. It's not just the nurse. It could be the care partner or anyone else that's going to come in contact with that patient. And sometimes they don't demand it, or maybe they can't speak, but you can tell by their nonverbal signals that they're very uncomfortable having a male providing care for them.
Another way to improve communication is to ask open-ended questions, or questions that don't require a yes or no answer. These types of questions help determine how well the individual understands information and elicit further response.
What we're trying to ascertain when we ask these questions is as much information as we can in the shortest period of time. And so by giving a person an idea of what it is we need them to answer for us and letting them go with it gives us a lot more information.
Some examples of open-ended questions include, what brings you here today? How may I help you? What do you eat for breakfast, lunch, or dinner? What do you believe caused your illness?
We've started using the question when we meet with patients and families, what do you consider excellent care? Because if we go in with an expectation of what we think excellent care is, and it's different from their expectation, then we set ourselves up sometimes not to be successful with their hospital stay. And that opens the door to a wide variety of conversation, which can teach you things about anything from what their living situation is to what kind of care providers they'll have when they leave the hospital, because they may have expectations around that, to people who just want you to come in and check on them and say, do you have water?
The care decisions that patients make can sometimes be influenced by culture. The patient may have beliefs about the cause of their illness. There may be customs around birth, illness, or death. And the patient may request complementary or alternative care, such as acupuncture, massage, or supplements that are important to them in their treatment. While many patients insist on being involved in their healthcare decisions, some cultures do not want the patient included. Instead, a certain family member may be considered the decision maker. You won't know the patient's preferences unless you ask.
Like Latino families, they come in bunches. They all come to know what's going on with the patient. They come in groups to decide for this patient what they're going to do, what is the treatment, and so on. So the patient doesn't decide by himself, but as a family, they make decisions for the patient's treatment.
Religion and spirituality may be very important to the patient or family during a hospital stay. The patient and family may request pictures or objects they feel are important to their spiritual health. They may practice a religion or have daily rituals that will need to be considered. These requests should be accommodated whenever possible.
When you are providing a service for me and you recognize my relationship with a higher being, you should accept that and honor that and be mindful of how I practice that outwardly so that I have that freedom.
Religious beliefs can also influence patient care. For example, some religions forbid blood transfusions or certain types of treatments. There are many religious-based health behaviors, and you must be sensitive to this possibility.
We had a gentleman who was transferred to us from another ICU, and he was at that point a failure to wean from mechanical ventilation, and his blood counts were a little low, and his wishes and his family's wishes were that he not have blood transfusions because of his beliefs. And they had this supplement that they wanted us to use to give to him so that he wouldn't have to have blood transfusions. So because he was on tube feedings, we accommodated that wish and put that stuff in his tube feedings, and it had the most awful smell. It mainly smelled like garlic, and it, like when you would clean, I mean, it was in his body odors, it was, you know, out in the hallway, it was just like all over, just permeated everything. And we stuck with it and gave it to him, and whether or not that helped, he never had to have a blood transfusion.
When performing procedures or administering care, you can prevent misunderstandings or conflicts that can arise from cultural differences. Explain to the patient what you're about to do and ask the patient if they have concerns. If there is an objection, ask the patient to explain while using a caring voice and demeanor. Finally, assure the patient that you will discuss their concerns with the appropriate caregiver, as there may be other options available. Ultimately, it is the patient's right to accept or refuse care, and we must respect and seek to understand these decisions, whether we agree with them or not. You should also be alert to whether an individual has a functional disability that may affect care and communication. For example, a patient who has had an illness, such as a stroke, may have difficulty expressing thoughts or understanding information, while other patients may not volunteer that they have trouble hearing or seeing. Don't assume the patient can see or hear well, and don't assume the patient understands or can answer your questions. Use open-ended questions and listen carefully for the response to determine understanding. Always remember that observation and active listening can be your greatest communication tools.
We had a heart transplant patient that actually had been with us for quite some time waiting for heart transplant, and we post-op have to teach them, and actually some before their operation, about all their medications, and not just what they are and when to take them, but the importance, because it is a lot of work after you have a transplant to keep up with all of that. And this gentleman did have an education, and he could read and write, and all of that had been assessed upon admission. And what we realized after working with him for a while is that although he could read and write, his reading comprehension was not at a very high level, and he didn't understand what the importance of the medications were. He couldn't keep them straight, and that just took some time with us giving them to him, asking him questions, because we needed him to repeat back to us what he was supposed to be doing and what he was taking and when and why, and we realized he didn't understand. So it took the nursing staff, we all worked with him, and actually many days, every single hour, when we would go in with our assessments, we would say, "Tell me about X medication," and have him repeat it back so that he could learn it before he was discharged.
Patients who are developmentally or physically challenged will require extra sensitivity and patience on the part of the healthcare professional to determine needs. Lorenzo Davis takes special care with blind patients when admitting them.
I'd usually feel their arm, let them know what I'm putting on their arm, joke with them so they can get a little laughter out of the day. Most of the times they're going up for surgery, and I don't want them to be depressed or stressed out much more than they already are, so I try to make them feel extremely comfortable when they're walking into the Vanderbilt Hospital.
Economic status may often have more influence over a person's healthcare decisions than ethnicity or religion. For instance, patients may not seek routine or preventative care because of limited incomes. Be sensitive to this when considering non-compliance with medications or visits to the emergency room for urgent needs. Dr. Wonder Drake grew up in rural Alabama. She has a personal understanding of what it's like to be poor.
I had an HIV patient tell me that she wasn't buying her HIV medicines because her son wanted to play football, pee-wee football, and that they had to pay the fee and the uniforms. And he's gone through so much with me having HIV, I can't deny him football. And so as a physician, I'm saying, but you're not going to be alive in 2 years for him to enjoy more football if you don't take your medicines. But for her, right now, it's her child being able to play pee-wee football with the other kids. And so she makes the choice between buying her medicines and paying for his fees to play football. And so I think it's really important for us to remember these things, that, we can't label a patient as non-compliant.
Many patients will have a significant other, and it may be important to learn who this is and the role they will play in their care. Cultural sensitivity means respecting the importance of this relationship, whether it's a couple who are very different in age, a same-sex couple, a couple who live together and are not married, a biracial couple, and so on. Sometimes a person's diet is dictated by religion, cultural customs, or a person's own beliefs, convictions, and preferences. You should not assume the patient will be able to eat or wish to eat the food on the hospital menu, or that the family can eat the food in the cafeteria. A nutritional assessment may be needed to determine the requirements of the patient, and alternatives to traditional meals should be made available in the facility.
We all want to be acknowledged. We all want to know that regardless as to why we're here, regardless as to who we are, what our race is, what our culture is, what our ethnicity is, what our gender may be, but that we're here because we're in pain, and that we want the absolute best care that we can receive in order to be put back together, if you will, and to be able to hopefully leave here better than when we arrived. And that is something that is a right to every single person who graces our properties.
Every patient and family member you encounter has a unique background and life story. Their personal cultural experience will affect how they view the world and what they consider appropriate care. It is our duty to understand that differences exist and that every person's background shapes their individual perspective. That's what cultural sensitivity is all about. And it's the key to compassionate and respectful care.